Welcome, ladies and gentlemen, to Forensic 101, the channel where the dead do the talking and the toxins keep on walking. Ladies and gentlemen, now that we are moving forward with forensic psychiatry and we have done a bit about the introduction, I think it's time we move on to the important symptoms which are commonly associated with mental illnesses or psychiatric disorders. See, the first among them is something that is called as a delusion. Now, a delusion is basically a condition in which the individual has a false, firm, unshakable belief about something and it does not waver, it does not go away even if evidence is presented which is contradicting his delusion. And that is our first MCQ today. A false but firm belief about something which is not a fact. This is called as a delusion. Delusion is a disorder of thought. It is something that is commonly seen in individuals who are suffering from anxiety disorders, who are suffering from schizophrenia, or in cases of individuals who have obsessive compulsive disorders. Just to cement a fact inside, we all have delusions of one or the other sort. Few of us believe that we could say cycle about 2 or 3 kilometers. Many of us believe that we can bat like Virat Kohli. But in fact, we rectify those delusions on the basis of our reasoning. But a delusion per se is a condition which cannot be rectified by reasoning alone. Now, there are a lot of types of delusion. The commonest among them is known as a delusion of grandeur or delusion of exaltation. This is a condition in which an individual believes he is very rich or very powerful or strong or very renowned, and this is generally seen in individuals who have maniacal disorders. Another very common type of delusion is called as the delusion of persecution. The individual imagines that he's going to be persecuted by his close family and friends. Like, he might believe that his family is going to poison him for his property, or he believes that his friends are going to kill him for his money, things like that. The third commonest delusion is known as the delusion of infidelity, the delusion of jealousy, or the Othello syndrome. Now, this happens generally in individuals, commonly in the males. They feel that their spouse or their significant other is being unfaithful to them, or that he or she is engaged in an extramarital affair. Now, this condition, as I said before, is also known as Othello syndrome. That's an MCQ for you guys. Next, you have something called as a delusion of reference. This is seen when an individual believes that everybody around him is talking about him, but in fact, they're not talking about. Now, this is commonly seen in individuals who have a predisposition or are suffering from schizophrenia. Next, we have something called as the delusion of influence or control. Now, this is more commonly seen in the United States of America. In this condition, the individual believes that his thought process, his feelings, and sometimes even his actions are actually being controlled by some other individual or supernatural force like aliens. Another type of delusion is called as the nihilistic delusion. This is commonly seen in individuals who are suffering from depression. What they feel or what they delude is that nothing exists, the world does not exist, there are no earthly matters. Now, this is known as a nihilistic delusion. Another MCQ for you guys. Now, remember when I said that the delusion of jealousy or infidelity or Othello syndrome is more common in males? Well, the females also have a more common delusion. That particular delusion is called as erotomania, also known as de Clerambault's syndrome. Another MCQ for you guys. Now, erotomania or de Clerambault's syndrome is a condition in which a person holds a firm delusion that another individual, usually of a higher social status or better looking or richer, is actually in love with him or her. The individual who suffers from this delusion tries very desperately to contact the other individual by phone, mails, personal visits, etc., and is tantamount to stalking. Now, this is generally seen in cases of psychosis and is more commonly seen in individuals with schizophrenia or bipolar disorders. A few other uncommon types of delusions are the delusion of a replacement of significant other, also known as Capgras syndrome. This is a syndrome in which the individual believes that someone close to him, like wife or husband, has been replaced by an exact body double. You also have something called as the delusion of disguise, also known as the Frigoli phenomena. Now, strangers are identified as familiar people in the patient's life. You also have something called as the delusion of parasitosis or Ekbom syndrome. Now, this is a form of psychosis where the patients acquire a delusional belief that they are infested with parasites when they don't have any other condition. Now, the importance of delusions in medical legal fields is that an individual who is suffering from a delusion and commits an unlawful act, the individual does not be held fully responsible for those acts. Or in other words, individual with a delusion, if he commits an illegal act under the influence of that delusion, he cannot be held guilty for it. Now, I hope you understood a little bit about delusions, and I really want those questions coming in. Give me those questions. Give me those questions. In the meantime, this is Dr. Som from Forensic 101 checking out. Ciao.